Dr. Knight, I have a couple of questions for you, if I might. You talked about evidence-based treatment with respect to opioid use disorder, substance use disorder, etc. Can you tell us exactly where the so-called safe supply fits in that? What is the evidence? And if you have some, I think it's important that you table that with the committee.
Thanks for the question. There are some reasons why I deliberately didn't talk about prescribed safer supply in my recommendations, and that is partly because I feel in the reading of the evidence that it exists to date that we don't have a clear picture of the role of prescribed safer supply. I do want to highlight that it really is an intervention that is trying to decrease people's reliance on the illicit toxic drug supply, and that there are other mechanisms to do that as well that could be considered, including what Dr. Vigo talked about in terms of that regulation of drug supply.
So Dr. Knight, if I hear you correctly, and this is your area of specialization, this is what you do, that realistically the use of, as you call it, prescribed safe supply, which I'm not entirely sure how much prescribing is going from some of the testimony we've heard, simply because there doesn't always appear to be a significant doctor-patient therapeutic relationship that exists. That being said, what I heard you say just now is the scientific evidence related to that is minimal. That would also go on then to consider that what we're seeing with this so-called safe supply is an experiment with a terribly vulnerable population. Is that what you see it as? I mean, yes, I agree that perhaps the intent was to save lives, but there's no evidence. And of course, you mentioned in one of your statements that it's important we use the best evidence there is.
I'd like to clarify that my position is not that there is no evidence for prescribed safer supply. My position is that there is conflicting evidence. We know that there are some benefits for people who access prescribed safer supply, and we know that there are some potential harms. And so what is not clear is where that balances out in terms of risks and harms. And anytime we do any intervention, that's the question: is the balance of benefits higher than the balance of harms?
So I'll just interrupt you there, Dr. Knight. And, when you look at this, again, you talked about the evidence. I think it's important that the evidence that you cite, that you table it with the committee. Would you undertake to doing that, please?
Yes, I can send some evidence to the committee. Absolutely.
And again, I did talk a bit about this, as we've heard not just today, but multiple times from many witnesses, that this is an extremely vulnerable population. Would you agree to that?
I would agree that lots of people with substance use disorders have aspects of vulnerability. There are lots of people who have substance use disorders who are highly functioning people in our society as well. I go back to the idea that really people...
Sorry, Dr. Knight, I just have limited time. The other question I would say to you is does it make sense then, without their consent, to do experiments, first of all, on anybody, but certainly on vulnerable populations and people who may or may not be impaired by substance use?
I said this earlier in one of my comments. When we're doing scientific research, there are checks and balances in terms of the ethics and in terms of...
Dr. Knight, there was no checks and balances in so-called safe supply. Do you think that folks who were receiving so-called safe supply consented to it being an experiment?
I can't speak to the individual conversations between the prescribers and the people who receive safer supply, but it would be general medical practice to discuss the risks and benefits of any treatment with individuals.
Well, I think, Dr. Knight, we've established already that many folks who receive so-called safe supply didn't even have a doctor-patient relationship with their prescriber. So how could you possibly think that they have any consent to be part of an experiment? Please, I mean, as you're a scientist. I think this is basic science, is it not?
I think, again, we need to go back to the idea that this brings us back to the need for recommendations on a national level in terms of what are the requirements
But Dr.
for
Knight, this is
provision
about a
of-
basic science experiment gone wrong.
Thank you. That's your time, Dr. Ellis.
Thanks, sir.